So now moving forward, we'll move to the next type of artery, which we'll get to discuss its anatomy. And this one too is also an artery which is found around the knee. Okay, so an artery which is found around the knee. So this artery is known as the inferior lateral genicular artery. Inferior lateral genicular artery. So you can also say lateral inferior genicular artery is still the same thing. Okay, it's still just the same thing. So what we have here is this. It's actually one of the 5 genicular branches of the popliteal artery, and it arises just above the lateral condyle of the tibia. Okay, so it passes laterally beneath the lateral head of the gastrocnemius and the fibular collateral ligament. So that once you could basically get the right image if this image was having ligaments and muscles together. Okay, so it arises from the popliteal artery in the popliteal fossa, and it originates opposite the tibial condyles. So it runs laterally deep to the lateral head of the gastrocnemius. Okay, it passes beneath the fibular, that's collateral ligament of the knee. So it reaches the anterior aspect of the knee joint. So it forms part of what all the arteries that have to now come together, so that the knee will now have what a blood supply. Okay, so it's anastomosed. It joins with superior lateral genicular artery, inferior medial genicular artery, anterior tibial recurrent artery, and some other branches of popliteal artery. So together they ensure that there is blood supply to the knee, there is blood supply to the muscles there and the ligaments. Okay, so we'll learn about the anatomy of this because we want to know about this complex, how will I put it, complex joint that usually used to occur at the knee. Do you understand? Surgical relevance, then how we do imagings of these arteries and some other branches of the popliteal artery, probably when there's an injury to the knee.